We're seeing dogs live longer and longer, and with the improvements in veterinary medicine, they're living longer, and we're starting to see more and more problems that are associated with old age. And at the same time, because the dogs are getting older, they have multiple problems at the same time. So sometimes traditional answers for one problem don't really work for an animal that has multiple other things going on. A good example is a dog that has orthopedic problems but also has metabolic or other problems that make anesthesia more risky or more difficult. And there are other examples like that. But when we're looking for ways to make an older dog feel better, feel more comfortable, there are a lot of alternative things that we can reach for when those primary alternatives are not a good option. Examples are some of the physical modalities that are used in rehabilitation medicine. We do a lot of work with water, using underwater treadmills in swimming. We do massage, we do various techniques that can be done with a dog awake, such as prolotherapy, which is a technique that injects into injured tissue to encourage healing of tissue. We do laser therapy to help manage tissue pain. Laser therapy is used a lot for muscle pain. In older dogs with chronic problems, we see a lot of muscle-related problems that are secondary to the underlying orthopedic problem, but can actually be more painful and more of a problem to the dog. So addressing the muscle with techniques like laser therapy, and also myofascial trigger point therapy, where you palpate and find the sore, tense spots in the muscle, and then use various techniques to relieve those trigger points. And trigger point therapy, you can use pressure, or a technique that is becoming more widely recognized is actually stimulating those trigger points with a fine needle, similar to an acupuncture needle, but focused directly at the point in the muscle that is painful. As a dog ages, they start to develop multiple problems, and those individual problems affect quality of life. They slow things down, and you get a snowball effect. They all start affecting each other, and the animal starts to decline. And if you can address those individual problems, bring the animal back over that threshold so they are feeling better and moving better, you can prolong good quality of life significantly. And we often see a dog come in that has really started to decline, isn't moving around as well as they should, and then they start to have a lot of other problems. But if we intervene early when they start to decline, there are a lot of things that we can do to improve quality of life and get them functioning really well. And we'll often see dogs go on for months to even years with good quality of life after that intervention, where otherwise that would have been something that would have likely led to euthanasia fairly quickly because of poor quality of life.